Hi everyone, this is Susan Brown, Director of the Center for Better Bones and the Better Bones Foundation, and I'm really happy to be with you again today to talk just a little bit on our Facebook Live session about exercise. You know, exercise is one of my favorite topics, and partly that's because I love exercise so much, because I feel so good when I do it, but also because exercise is one of the really underutilized, very powerful modalities to build and maintain bone health. For example, some of you might remember the study I reported on from the Mayo Clinic where they had women who had already fractured their spine do exercises where they laid down and lift up their chest, kind of like the yoga cobra posture, but not lifting the chest that much. If you don't remember the study, you can go back and look through my blogs and you'll find it. They laid down, lift up their chest, and eventually they had them wear little weight packs on their chest. On their backs, I mean to say. We often have people use the weighted vest when they do this exercise. These women who had already fractured did this exercise 2 years, just a few minutes a day. The vast majority of those women never fractured again, even as long as 7 years later when they studied them. Just goes to show you, you build for example, you build the muscles around the spine, those muscles that go up and down the spine, those back extensor muscles right up and down the spine, and you will build the density of the spine and prevent fractures, really help to prevent fractures. The other interesting case is looking at menopausal bone loss. You know, where you really see the benefits of exercise. The average woman loses 10% of her bone mass in those first few years before the last period, the first 3 or 4, till the first 5 after. The average woman in that span loses 10%. I see in my office many women losing 20% of their bone mass. And I'm always looking to see who loses least bone during menopause, during the menopausal transition. And the one woman I saw who didn't lose any bone was a woman who taught yoga, and she gave like 2 or 3 classes every day. She was constantly doing exercise that had the muscles and the tendons pulling on the bone, because remember, in exercise, one of the major impacts is that there is a tugging on the bone from the tendon, and that actually causes the bone to bend a little, and that actually sends a signal to build new bone. So it's very interesting. At any stage of life, they've taken 70, 80, 90-year-olds in wheelchairs and have them doing weights, and they were actually able to build bone. So exercise is my favorite modality. I'm happy to talk about it, love to talk about it. In fact, we have an exercise DVD that you might have seen. You should all use it, do it. But the study I'm reporting on today is a study that looked at the question of well-being, of happiness, of how much exercise do you need to do to have a higher level of psychological well-being, that is a higher level of happiness. Many of you could probably already answer this question because you've noticed yourself in your own daily life. But what this study found was, number one, as you'd expect, that sedentary people were more depressed, had a less level of well-being. And this is self-identified well-being, but they reported not feeling as happy as well off. The sedentary people first had the lowest ranking. Then the people who did rather light intensity exercise, right away there was a higher level of psychological well-being and less depression. When you moved up to a more moderate level of intensity exercise, more exercise a day, a little more vigorous, there was also much less depression and, interestingly enough, less pain. And I've noticed this too in a recent study on arthritis, showing that the more vigorous exercise really helped reduce the pain of arthritis. So it's interesting, you know, we can't tell everything from one study, but in this study, even a small amount of exercise really helped to increase your happiness, your psychological well-being, and a more vigorous amount of exercise really helped to reduce pain as well as to increase one's sense of well-being. And then they looked at individuals who did high-intensity exercise, people who really worked out significantly. And what they found is they didn't have any detrimental effect on their psychological well-being. And this was of interesting interest to the researchers, and this is the study from the University of Connecticut, and we can give you that reference if you want. But these researchers were interested because other studies had shown that people who do high intensity exercise actually might feel a little less well, either because they exhaust their body and they end up with a psychological sort of less well-being. But they didn't find this to be true. And it's interesting, certainly in most of the clients I see, the ones that enjoy more vigorous exercise, they definitely feel better. So the question of how much exercise do you need to actually be happier? Well, these researchers said you don't need very much, maybe 20 minutes a day. What we're struck with, and I'm sure all of you have noticed it, that you do even a little bit of exercise and you're going to feel better. This is what they found in the study. I think another great way to look at that is to think about taking a break even every hour. In fact, they found that people that sat all day had the worst effect on their psychological well-being and on their depression. And you know, we've reported that sitting is now being called the new smoking because it's so detrimental to the body. So every few minutes to get up, every few minutes, let's say every 60 minutes to get up and spend maybe 1 minute of exercise. Now, in that sense, I'm going to show you a couple exercises right now that are actually aimed to increase happiness. Because where does happiness come from? Happiness, and in the deepest sense, joy, comes from the heart. And so let's look at a couple exercises that the people in the Orient who study the ancient science of how to move energy through the meridians of the body. These are a couple of exercises they use to expand the energy of the heart and to move the energy of the meridian of the heart, which runs along this line from the chest down to the hand. These are really fun, and you can do them sitting right at work. So the one is to take your elbows and put them together and to bring them up like this. This is kind of an exercise that moves the shoulders up and down and the elbows together. And what that does is it stretches and opens the meridian of the heart. Let's try it. Put your elbows together and then right up. Okay? Got how it does? And at home, you might do it 15, 20 times. It's a nice stretch. And you can think that you're opening your heart, and opening the heart, allowing more of the happiness and joy to come out. The second exercise is one that actually also opens the heart meridian. I'm going to stand up to show you. And you can, at work, you just jump right up and say, I'm taking a break. I'm going to expand the energy of my heart. You stretch your arms out like this. Okay? Put your left palm up and your right palm down. Now stretch your arms as far as you can so you have that nice stretch. When you want to move energy through the meridians, stretching really helps. So not just gently, but really stretch them out. And then switch. So put your left palm down and your right palm up. See how it is? So then you switch, you switch, you switch. And after you get used to that, you say, okay, kind of extend your fingers, stretch out, switch, switch. Then what you do is when you switch, actually turn as far as you can. Turn this left palm and right palm as far as you can. In other words, stretch them more. It's like you're opening the heart with that stretch. Stretch them more. Stretch them more. Almost as like you're wringing a towel, you know. It's really a lot of fun. You may do that 20, 30 times. These are both exercises to open the meridians of the heart to help bring more joy into the body, more happiness. So before I get to your questions, let me just make a couple summary suggestions about the Better Bones guidelines for exercise, particularly in regard to happiness and increasing your emotional well-being. One thing is, find an exercise that you really enjoy. You should enjoy the exercise while you do it, and you should feel good afterwards. When you're doing the exercise, actually smile, because smiling in self has many impacts on the body. So experiment with finding an exercise you like. It can be these simple stretches. It can be getting up and doing some jogging. It can be we like a little hopping. It can be some deep knee bends, anything. But to do exercise frequently during the day, something that you enjoy and that you feel good afterwards. The exercise, in the long run, you'd like to develop exercise that can build or at least maintain muscle. Now remember, the average person, the average woman is going to lose 45% of her muscle and 45% of her bone as she ages from 35 to 85. That is if you do nothing. So you don't want that to happen, and so you want to do lots of things, including regular exercise. So try to build muscle and try to build bone, and flexibility is very important. Like these exercises, they increase flexibility of the joints, the muscles, the tissues, the tendons, the cartilage, the collagen. And remember, here's a special tip. When you stretch collagen, you cause it to send a signal to self-repair. So the stretching of collagen, the stretching of all the tissue is very important to initiate repair. So the other thing is, the other tip I would give you right now as far as Better Bones exercise guidelines for happiness is to try to get a burst of activity like every hour. I have friends that even set their watch. They set their watch, their little Fitbit, and every hour they get up and do a couple things. And you can find which ones you like most, but I suggest during the day, be sure to have at least 30 minutes of aerobic activity, and we like to do strength training 2 or 3 times a week. Okay, so that's the story on happiness. Exercise builds happiness, builds well-being. It certainly does build bone. And I hope that each of you take the time to care for yourself in that way. So, as usual, we have a few minutes that I want to dedicate to questions and answers. This is a way that you can actually ask me any personal question, not the questions you have about the Better Bones program, questions about bone health, questions that we might be able to help you with. Frequently, people ask me all sorts of questions, and we want to have this opportunity to have that I can answer them. So let's see what questions we have and how we can help you out today. The first question is, how safe is yoga for women with osteoporosis? Well, that's a really good question. You might remember the study I reported on recently, an Indian study done in India on women who had osteoporosis, and they did a very significant yoga program 4 or 5 days a week, all kinds of stretching, all kinds of movements, and they built bone nicely, and they did not have any injury. Now, the caveat there is everyone is different. So it rarely, but it can happen that somebody with extreme, like spinal weakness, does a flexion exercise, and these are the exercises where you bend down, and they actually can put compression on the spine and cause some damage and cause a spinal fracture. It's very rare, but if you have if you have already experienced a spinal fracture, you should definitely take great care to have your yoga modified, not to do too many forward bends. If you have simply a low bone density, that doesn't necessarily mean that your bones are weak, but you want to be careful if the bone density is extremely low, and the yoga teacher could adjust those flexion exercises, those bending forward exercises, if necessary. Remember, comfort is always a sign. Don't stress yourself. Don't do something that might be painful on the muscles. Generally, the muscles would give you a little problem before the bone breaks. And of course, there's always physical therapy. If you say, I have a real special concern, I have a lot of pain in my back, or I've actually experienced a fracture, be sure to go to a physical therapist and have them help decide the amount of forward bending you can do. But there's many, many yoga exercises that can help you, and if you're concerned, your teacher can help you adapt the exercises for one that might have spinal weakness. Yoga is great for hip bone density because even a simple yoga exercise like standing on one leg puts a lot of impact on the other leg. So some of the postures we would not think are strenuous are very helpful. And remember, it's largely the muscles pulling on the tendons that pull on the bone that send that signal that the bone is being loaded and that the bone needs to grow stronger. Yoga is great. And what's the other great benefit of yoga? Is it helps reduce the hormones of distress. More and more as we study bone, we see that worry, anxiety, nervousness, and high cortisol, which is associated with these stress states, is very damaging to bone. So yoga has the benefit that it actually reduces the hormone of distress. Like if I go lift a lot of weights, I'm going to raise my cortisol, raise my hormones of distress. But if we do yoga, tai chi, qigong, it actually lowers them. Very excellent idea to do yoga. Just take care if you've had fractures or have severe spine issues. The next question we have here is, should I wear a weight vest for exercises other than walking? Now, what's the principle here? The principle is we build bone by loading the bones, by putting weight on the bones. We put a lot of weight on the bone when we walk, right? Because with every step down, that puts an impact on the bone. If I take a step like a march, a high step, ooh, that's more impact. Or if I hop, that's even more. If I wear a weighted vest, it puts actually more impact with every step, as well as just putting direct impact on the shoulders, the spine, the muscles that will cause the bone to grow stronger. So that study I mentioned where the woman actually gained bone density during menopause, they were using weighted vests when they did their workout. So using a weighted vest during a workout is a very good idea. And using a weighted vest when you work, but if you say, look, I don't go to the gym, I don't lift weights, the weighted vest during your your cleaning and your laundry, that's all very helpful. Just in your everyday activities, you will build strength with the weighted vest. And so you can wear it in any activity you want. Walking, I really suggest people take the vest because it's like do less and accomplish more. You don't have to do anything special. You're already walking, you put the vest on, you get a double benefit. Good idea. And you'll notice your strength builds. Remember, it's a question of building strength. That's what we want to do, is build strength. Let's see what other questions we got here. Questions about exercise and about other topics going here. Okay. So one of the things we want to emphasize is, I'm just trying to check these questions. It's a little bit difficult to see them. People have asked me about the value of other mindful exercises like Qigong and Tai Chi. Like I mentioned, they're very helpful because they reduce the hormones of distress, but they're also particularly helpful because they increase the flow of energy in the body. And that brings me to mention one of the very interesting exercises we don't think of very much. In fact, I read a book once that said exercise without movement. And you know what they were talking about? They were talking about breathing. Breathing is one of the most important exercises we can do. And so I'm going to suggest that when you do your exercise, you consider your breathing patterns. We attempt to breathe deeply into the abdomen because that will really help. Deep breathing, you'll notice that's a common thing to much of yoga, to much of Tai Chi, to much of Qigong. And what that allows us to do is to have better coordination into the body. When you quiet the breath, you will quiet the mind. So no matter what exercise you do, you might take a few minutes to do some deep breathing before, and certainly to rest between bouts of exercise. Even here, we use a vibrational platform at the Center for Better Bones. And what they teach us is you do the exercise, the vibration, a minute or two, then you rest. You always need to rest between the exercises and do some deep breathing. And that will help to keep the body in a constant, stable state, bring lots of oxygen in, reduce the hormones of distress. So even if you're doing a vigorous exercise, or you're doing these mindful exercises, be sure to pay attention to the one exercise you can do without much movement at all, which is breathing. The more oxygen we bring into the system, the more we're able to nourish every cell. And remember, when we increase the oxygen in the system, we also alkalize, also help to balance the pH. It's been a lot of fun talking with you today. I hope each of you go back and make a commitment to get that 30 minutes of aerobic every day, and maybe spend a few minutes, maybe let's say a few minutes in the day, maybe every hour or two, you get up, you move about, you do some activity. That will really help a lot. I wish you all happiness, all the happiness that good health and exercise can bring you. We'll be talking next week, Thursday at 12:30. You can certainly invite your friends and others who have questions. We'd be happy to answer those questions. And I suggest that everyone pay attention to the Better Bones blog that comes out early in the week, because many times we're going to discuss details of what is in those blogs in these question and answer periods. So once again, I thank you very much for your attention. Look forward to seeing you next week. Bye for now.